Your doctor has suggested you have a look at this presentation concerning trochanteric bursitis, and you may have this condition. Trochanteric bursitis is, in terms, also used for a more broader condition called greater trochanteric pain syndrome, which is probably a more accurate reflection of what we understand. We start off looking at the anatomy of the trochanteric bursa and the surrounding areas. You've got the tensor fascia lata, the gluteus maximus, gluteus medius, the gluteus minimus, and then you've got little bursae between some of those muscles. So all of those muscles are involved with bringing the leg out from the midline, stabilizing one hip while the foot on the other side is off the ground so you don't fall over. And they're also involved in rotating the hip in and out. So there are a number of different activities that can cause this type of pain. Now you understand the complexity of the problem. There's a number of different structures that can be causing your pain, and maybe one or two of them are. Typically, the patient with greater trochanteric pain syndrome starts off with pain on the outside of the hip, and it can run down the side of the thigh, but rarely below the knee. It's usually set off by an unaccustomed activity like a lot of walking or climbing, a new activity like dancing or tennis, something like that. And the pain is usually of a very dull quality, aggravated by walking briskly, usually associated with some stiffness at the side of the hip after inactivity, like after sitting down for a while or lying down for a while. It's painful to touch over the hip in the area of the pain. It's tender. And of course, if you lie on that side, it's also tender. There can be no obvious cause for it to happen. It happens usually in middle life and later, and it probably is contributed to by just poor muscle tone. So understanding that, you can then understand our approaches to management. Now they can include local injection, sometimes local rubs, sometimes anti-inflammatory medication or painkillers. But as well as all of those, or instead of all of those, one can also undertake a program of stretching and strengthening. And this may well be all you need to get this sorted out in the short term. I prepared some demonstrations of the exercises. The first one is a stretch, and the stretch is outside of the thigh to stretch the structures that are going over the trochanteric bursa, and all the structures in the area will be stretched with this fairly simple stretch. Using the wall of support, put the right foot at the other side of the left foot, and you can flex the left knee. Lean into the wall to stretch the right side. I'm going to show you this on another plane now. Put the foot behind and then lean into the support and hold for about 15 seconds. Relax for 5 and repeat this about 5 times twice daily. Now you should undertake that stretch every day, and you should start your exercise program with that, and you can then finish with doing some stretches after you've done your exercises. And then the exercises are simple. There are 3, and they involve strengthening different elements that move your hip. To strengthen the hip external rotators, lie down on the side, elbows supporting the torso, knees together, feet together. Lift the knee, hold for about 10 seconds, relax down slowly, hold for 5 seconds, and repeat. And repeat this exercise about 10 times, twice daily. Now that exercise is fairly simple and easy. You get better at doing them. You'll feel a fatigue at the beginning when you do them, and as the fatigue improves, you can do them more frequently or lift the knee for longer periods. The next exercise involves strengthening the gluteus medius, so that muscle that stabilizes your hip while the foot on the other side is off the ground, so you don't collapse down. Stand straight, take the weight off the left foot by hitching up the pelvis, keeping your right side as straight as possible. Hold for a count of 10 and relax for about 3 or 4 and repeat. Stand on the book, take the weight off the left side, hold for 10 seconds, relax for 5 seconds, hold again for 10 seconds, and repeat that 5 times twice daily and longer if needed. And then the last exercise involves strengthening the big muscles that flex or bend up the hip. To strengthen the hip flexors, stand straight, lift the hip to 90 degrees and the knee to 90 degrees, hold for 10 seconds, rest for 5 seconds, repeat. If balance is poor, one can use a chair or something like that to hold balance, but not to bear weight, to allow the exercise to be completed about 5 times twice daily. Now you should do those exercises probably twice daily initially, and do them 5 to 10 times twice daily, and hold for about 5 seconds, relax for 3 for each of them. And then as time goes on, you can hold for longer, and you can do them more repetitions in each session. And you should continue to do those exercises at least once daily, a long time after all your symptoms have settled, to improve and strengthen the hip muscles so that you lessen the chances of recurrence. You can also do them on a side that has not been affected in order to keep balance and to strengthen your hip muscles anyway, to prevent the chances of recurrence on either side. If this doesn't begin to solve your problem over a week or two and your symptoms are not improving, then you should go back to your doctor and talk to him about it. It may be that the diagnosis needs to be revised. You may need to see a physiotherapist or an expert to have treatment that is beyond the scope of this medium.